Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
An interesting article in the Post about the GLP-1 drugs that we've been addressing for some time. And they just recognize that it is the wonder drug of 2025, 24, 25. Uh, they are recognizing that it's probably going to revolutionize many things in the field of medicine. So that's something we've recognized for some time now.
Dr.
The
Kelly, how
ex-FDA.
long do you think it'll take before the impact is really felt? I mean, 5 years, well, I know for people it's quickly, but for reduction in hypertension, reduction in other diabetes and things that are caused by weight gain, do you think it'll be 5 years, 10 years before we really notice that there's been a change?
Well, I think one of the problems is we don't know the long-term
Hmm.
adverse effects of GLP-1s. So I think within 5 years we're going to have a good idea. But if it continues as it is, it's going to be revolutionary and will modify. I'd say about 5 years to directly answer your
Okay,
question.
thanks. I was wondering about that.
Yeah, I'm still wondering about that because the question of what are the long-term side effects?
Right,
We've been
right.
using it for a short period of time, and we've seen some things that they say are going to be evident, like the laxity of the skin, face skin, and some other things, but maybe more or less. And so it's going to take time to really find out.
The
So
consequences.
my
Right.
guess is 5 years. Yeah.
Thank you.
Calendar, does that mean that after the 5 years, let's say, um, the prices are going to go up or is it going to go down?
Say again.
Is the price going to go up or down?
Go down. It almost always goes down.
There'll be generics at some point, right?
Yeah, right.
Yeah.
And that's what drives it down. Prices down. Right now, see, the GLP-1 drugs only approved for diabetes and not even for weight loss. So the real benefit of the drug is not even evident because it's not approved and it's not Medicare, Medicaid approved for the other causes. But it has benefits on just about every organ system. And that's the question that Patty Malone was addressing in terms of when are people going to find out all of the benefits of the drugs and also some of the adverse side effects. And but it's going to be interesting to watch. It's a very important time, and uh, keeping up with the drug and getting it to be safely used for all the different organ systems it helps is going to be an interesting journey to behold.
Dr. Callender,
Okay.
that's just type 2 diabetes, right? Is it just type 2 or is it because,
Yes, yes,
yeah,
just type 2 diabetes. That's
okay.
right. Type 2
Thank you.
diabetes. Yeah. Okay, John, I guess we can go to your first article. Huh. This is an interesting article that kind of addresses the fact that eating in any 8-hour window daily yields durable weight loss. In other words, discipline is very important. And if you go without eating for an 8-hour period, it's going to be helpful. This is based upon a European study. Um, Actually, there have been many studies over time that have addressed this concept of having an 8 hour eating window. Also, the concept of not eating after 6 p.m. at night is a similar concept that is associated with consistent weight loss. Whether you're measuring the BMI or your waist to hip circumference, the consequences are the same if you have intermittent fasting, because that's really what it's all about. Uh, well, the interesting part of this kind of fasting is that it doesn't address the types of food that you eat. It just addresses the fasting aspect of it. But it works, so it's interesting. But when you combine that with eating the right nutritional foods, then that makes it even better. Any comments about this when you combine this with exercise and meditation? Uh, it's tough to beat. Any comments, pro or con?
Good morning, everybody. As you all know, I said that I was doing not eating after 4 o'clock. And I did it mainly because I didn't have to restrict what I was eating. So the fact that I lost weight without restricting what I was eating, I'm sure if I did the proper diets, I would have lost more by now. But so far, I'm happy with the way it's going.
Thanks for sharing. Any other comments? Darryl?
Yeah, a lot of restaurants offer an early bird dinner for seniors, which is usually around before 6 o'clock. So that could fit into that 8 hour window. 8 hour window means like if you eat breakfast at 8 in the morning, your last meal is going to be before 4 p.m.
Thanks for sharing. Any other comments? If not, we'll go to the next article. One of the things that sometimes don't realize is that the GLP-1 drugs are all anti-inflammatory drugs. So when you have anti-inflammatory drugs and anti-inflammatory diets, this helps reduce the risk of Alzheimer's disease and deaths related thereto. Um, Alzheimer's disease-related mortality is something that they hand in glove, they go together. And there is the feeling that maybe these anti-inflammatory diets, which are the the plant-based diets, are actually what they're talking about, and they uh, decrease the amount of neuroinflammation, which of course is what is the problem with Alzheimer's disease. So convincing people uh, to adopt plant-based diets is something that is good for one and all. And so getting more and more evidence all the time that the plant-based diet is the diet of choice if you want to have a quality of life as you age. Um, One of the things that is important is to appreciate that right now we don't have a cure for Alzheimer's, and so uh, having a plant-based diet becomes more important. Dal Armstead?
I,
Yeah, the
I
most
agree with that. I'm sorry, go ahead.
yeah, the most inflammatory foods are red and processed meats, added sugars, fried foods, processed foods, and alcohol.
Thanks for sharing. Patty, you had something to say?
Yeah, I was going to comment on the fact that unfortunately, right now in this day and age, the foods that are the healthiest for you are also very expensive. Fruits and vegetables have gone up tremendously. I mean, and now that all our fruits are going to be imported and there's the tariffs on those countries, it makes those very expensive. I don't know if you've been to the supermarket lately, Dr. Callender, but fruits and vegetables are outrageously high. And it the people who have low income, uh, they I think they have a harder time, and those are the people who will be greatly impacted, I think, with not being able to do this, and they're probably the people that need it the most.
I think that's a very good point. And one of the things that when people talk about these uh, islands where you have the fast food places, one of the reasons they thrive is because they're cheaper. And the Whole Foods and all the other places that sell these plant-based diets and good food are much more expensive. And so your point is well taken. And so as we advance, we need to try to make food less expensive rather than more expensive, because when that happens, it puts our people of color in a poorer position. Elizabeth, and then Darryl again.
Good morning, Dr. Keller. Good morning, everyone. Yes, one of the quick methods that I use when I'm doing workshop is I say stick to the perimeter of the store and try and not go into the area of the store. And so that keeps them on track without concentrating on certain foods. Thank you.
Thank you for sharing. Darryl?
Yeah, about food prices and overall food budget. Yes, fruits and vegetables are expensive, and if you go organic, they're even more expensive. We talk about a plant-based diet means primarily plant-based, and that's different from a vegan or vegetarian diet where there is no meat. So if you take out meat from your grocery budget, even though that you're spending more on fruits and vegetables, your overall budget without meat is going to be far less. It's going to be in the range of 20 to 25% less if you don't buy and consume meat.
Any other comments? John Tatum.
Yeah, one thing I'm getting out of this is that if the food that's good for you is more expensive, then that means uh, poor people are also going to be have poor diets, and they're going to be fat and with poor diet. So it's like counterproductive.
Yeah, and I think that's what we're seeing. And it's going to be worse now as a consequence of that. So uh, seems like everything's stacked against people who aren't wealthy, and I think that's getting more and more the case. And the comments, if not, we'll move to the next article. This is an interesting article that talks about uh, the importance of walnuts and the importance of dietary changes and how the, the chemicals in walnuts have compounds that actually decrease the likelihood of getting colon cancer, and singles out the particular phytochemicals which are present and which may be responsible for decreasing the likelihood of colon cancer, which, of course, is a disease that is thought to be preventable if you get colonoscopy, and also if you have a plant-based diet. Again, But the walnut is the nuts, of course, are desirable by themselves, but the walnut in particular is singled out in this article, a European article that talks about how these particular nuts particularly address the colon cancer issue.
Does that mean,
Can't hear you, Pat. Can't hear you, Patty.
does that mean maybe we should eat more chocolate chip cookies?
I don't know. Do they have walnuts in
Yeah.
them? Oh, okay. I see. Uh, interesting. Okay.
Uh,
5 to 10 walnuts per day is suggested. That's what he's suggesting.
there's a side
Interesting.
effect though. If you eat too many walnuts, there's a side effect.
Say again.
There's a horrible side effect if you eat too many walnuts.
Oh, well, moderation is the key. Right. What's the side effect you're addressing?
Uh, well, if you eat a whole bag of walnuts, you're gonna get diarrhea.
Oh, well, yeah, moderation is
Moderation.
the key. Moderation is the key. Yeah. Okay. Let's go to the next article. This is an article that talks about the types of foods that you might eat if you have high blood pressure. And since more than 50% of people of color have hypertension, this is interesting. And they identify uh, yogurt and sauerkraut and other things. And they talk about probiotics as well as being a way of getting the good bacteria to help soften up your the blood vessel linings, which is what you're measuring when you have high blood pressure, is that the blood vessels thicker and, requires higher pressures, which then cause worsening of the arteriosclerosis. And it's interesting. They studied more than 15,000 people, so it's a interesting way of addressing it. So the people who had more of the live microbes, uh, uh, the ones who had the most, who ate the least of them, had high rates of death, and of course, uh, the association of sitting a lot with that and the sedentary lifestyle increased the death rates. And so those are the things that we talk about: healthy diet, exercise, and um, recognizing that sitting is the new smoking in terms of increasing morbidity and mortality. The issue of 150 minutes of exercise every week is emphasized, and we've talked about the importance of when you sit for longer than 30 minutes, you need to do the pedal exercise to get up and walk around to minimize the negative effects of sitting. And of course, the vegetables and yogurt and the other things are helpful. Uh, any other questions or concerns or anything you want to share about uh, eating the macro-rich foods in your diet? How many of you eat yogurt and probiotics? Uh,
I had a question, Dr. Callender. What
yes.
what is the difference between pre and post biotics or pre and probiotics?
I don't know. I don't know about prebiotics. I know only about the probiotics.
There's a lot of the ones in the stores now have pre and pro.
Oh, I see. Okay. I'm not aware of the difference. Anybody on the line aware? Darryl?
Yeah, prebiotics and probiotics are both beneficial for gut health, but work in different ways. Probiotics are live microorganisms, typically bacteria. They're added to the gut to help support digestion and overall health. Prebiotics, on the other hand, are non-digestible fibers that act as food for the probiotics, helping them grow and thrive.
Thank you for sharing, Darryl.
That's
Thank you very much.
interesting.
So examples of prebiotics are garlic, onions, bananas, whole grains, oats, asparagus, and Jerusalem artichokes. Examples of the probiotics that are in this article are yogurt, kefir, sauerkraut, and kimchi.
Thank you very much. Elizabeth?
Yes, they're now in some research they'll talk about symbiotic, which has three components.
Okay. And examples of those are what? Do you have any of the symbiotics? Elizabeth?
I'm sorry, I'm trying to multitask right now. Just give me a moment because I'm driving.
Oh, okay. All right.
Okay.
Okay. Okay. And
Right, quickly, they said symbiotic. Of course, it's also combined with what Darryl said. So this is just piggybacking on that. It's just in a nutshell, it's fuels your body and your gut with friendly bacteria found in probiotic. Symbiotic can contribute to achieving and maintaining a nourished immune system and healthy microbiome by supporting healthy intestinal function and the ability to absorb nutrients from food and supplements. And so this is formulated with a prebiotic, postbiotic, in addition to the 8 strands of probiotic at 10 billion CFUs.
thank you for sharing. Okay. Let's go to the next article. This is an article that talks about the good old ultra processed foods, which are readily available and make up 70% of the food supply in America. And this is what you find at most of the fast food stores, as well as uh, most of the meats that we talk about eating are associated with ultra processed foods. And this, of course, the link between that and high blood pressure, cardiovascular disease, cancer, and digestive diseases is very high. And this is why the emphasis is on avoiding ultra processed foods and trying to find a plant-based diet rather than a meat-based diet. And I think that this is something that we talk about virtually on every Thursday session that we have. And so healthy eating is one of the most important things you can do along with the exercise and meditation. Um, and yes, they negatively affect your heart, brain, and all parts of your body. And that's why vegetarians and vegans live longer than meat eaters. And as Patty had said earlier in the program, that um, these eating the non-processed foods, the foods that aren't ultra-processed, are cheaper than the food that are the plant-based diets, which are more expensive. And, of course, if as Darryl had said, if you cut out meat from it, then you also help your other diet. Any comments on this? Because this is something that time and time again we're reading more and more articles that are emphasizing the importance of plant-based diets, veggies, nuts, fruits, and legumes. Any comments or additional comments on this subject, which is vital, I think. Okay, let's go to the next article. Uh, this is an article that talks about the circulation of your hands and feet, and we call it peripheral artery disease because the circulation to your hands and feet are the peripheral arteries, and these are the arteries which, if they're not circulating well, wind up you losing your toes and your feet and your legs as well. And there's ways that you can find out whether you have a neuropathy or you have a peripheral or lack of circulation to your hands and arms. And those people who have Raynaud's disease or syndrome or have vasoconstriction in those areas are likely to feel cold in their hands or feet, more so than other people. There are other diseases like hyper and hypothyroidism that contribute to this as well as anemia. But if you think you have this kind of situation, we have vascular surgeons that actually were able to check the circulation in your hands and feet. And then they talk about other nutrients that will help you. As you can see, the iron, the B12, and the folates are important. And these are the sources of the iron, the B12, and the folate, which really help the circulation in the upper and lower extremities. So it's not something that you should brush off, but if you have symptoms in your hands and feet, then it's important to check with your doctor. John Tatum.
Yeah, do blood thinners play a role in this?
Very little. I think blood thinners play a role if you have arteriosclerosis and you have a clots. If you have blood clots, then blood thinners play a role, and they use the treatment for blood clots. But when you have poor circulation, it leads to blood clots. And if you get blood clots, then anticoagulations or blood thinners are the treatment of choice. But of course, these nutrients are likely to increase the circulation to the upper and lower extremities, the hands out. Any other comments or questions about this article, which and you find as we age, we need more folic acid and B12 and iron. John Buchanan?
Yes, I have historically had low iron. In fact, when I've gone to donate blood several times, probably, well, it's not that often, but over 26 years, maybe 4 or 5 times I've been denied the ability to donate because my iron was so low. So they actually put me on iron pills, and since then, my iron level, my hematocrit and hemoglobin have been adequate. But I was wondering, they usually ask me questions. Do you chew ice? Are you eating paper? They ask some very weird questions, to try to figure out why I was anemic. And it's not normal for men to be anemic. It's more probable that women are anemic. So what do you think about that?
Well, women have a lower hemoglobin and hematocrit, but they have a variant. There's an expected hemoglobin and hematocrit level for women as well. It's just lower than men. But uh, eating ice and talk about uh, being overhydrated and uh, uh, having a relatively lower iron level as a consequence. But uh, there are those who feel that the iron levels can be increased by, as you mentioned, taking iron tablets or taking more of these iron-containing substances that you see here. Uh, and of course, some would argue that there are, are meats that supply iron as well, liver and other things. So those are some of the thoughts about that. Betty
Yeah,
Blaylock?
I'm sorry, that could be another reason, because when I was 25 or 26, I just cut back the red meat, so that could be
Oh,
something to do with it.
yeah, yeah, yeah.
Thanks.
Betty Blaylock?
Yes. With respect to the cold feet, um, I have been suffering with, well, not suffering, but I've had problems with my feet for a long, long time. I think it started probably during menopause, but especially now that I have a dropped foot after one of my hip surgeries, my that foot definitely is cold. But when I go to bed at night and lay down, it's cold during the day. But when I go to bed at night and lay down, it gets very hot. So I don't know whether that is normal or what, but it, it's almost burning, it feel like, when
That,
I'm laying down.
that's very interesting because when you lay down, the circulation to the foot is probably increased uh, because of the body position. Um, Janice, you had a comment?
Chris, yes, I have been told I have neuropathy, and I do have the cold hands and the cold feet. With my feet, it's basically at night. It'll happen sometimes during the day. And for me to get a good night's sleep, I sleep with socks, thick socks. We've talked before about the medication gabapentin, and this is what the doctor suggested that I take. I don't like taking it because it makes me very sleepy. And if the coldness bothers me a lot at night, I will take it sometimes at night. But it's something that I'm just dealing with.
Gabapentin is a treatment for the neuropathy
Mhm.
for the most part, and
Yes.
uh, which is different from the peripheral arterial disease where you don't have circulation. So the difference between the neuropathy and the feeling that you get, or the feeling that you get that the gabapentin actually deals with is different from the peripheral arterial disease, where where your feet and hands are very cold, and sometimes they have tests that are able to look at the circulation and differentiate whether it's the blood supply that is decreased or whether it's the neuropathy that is the situation. And
Okay.
if it is the neuropathy, then you're right. Gabapentin is probably one of the drugs that is more helpful for the neuropathy. Whereas if it's circulatory problems, uh, then that requires a different solution. Sometimes even surgical solutions.
Mm.
Any other comments or questions about the neuropathy and the peripheral vascular situation in which your hands and feet are cold? It's interesting your comment about the socks making a difference for you.
Mhm.
Any other comments? If not, this is an article that talks about the fact that if you have type 1 diabetes diagnosed in adulthood, that your cardiovascular risk and mortality are greater, particularly if the diabetes is not controlled or if it's associated with smoking and obesity. And the advent of insulin pump usage in older patients is something that has allowed the blood sugars to be normalized and can help prevent the cardiovascular risk and the um, cardiovascular risk and the risk of poor glucose control, and also the higher morbidity and mortality rate associated with poor control of type 1 diabetes in the adult. And they talk about the ages at which the diagnosis is made. And those who have a diagnosis made when they're over 40, uh, unless they uh, properly control their blood sugars and their hemoglobin A1Cs, are more likely to have cardiovascular disease than if they're properly controlled and their at-risk mortality is not as high. Type 1 diabetes is the diabetes in which your pancreas does not produce insulin. Type 2 diabetes, where your insulin is produced, but it's just not effective. Any comments about this? Because uh, type 1 diabetes is occurring more often in adults than formerly thought.
Dr.
John
Callender,
Buchanan?
is this happening because there's damage to the pancreas later in life? I mean, I've always thought of type 1 diabetes as something that is happens, is identified as a child generally, that your pancreas is malfunctioning. So are these people that have had an okay pancreas up until adulthood? And I I, I didn't
I
even
don't
realize
know.
there was that
I don't know.
incidence.
I don't know the reason why it occurs, but it does occur in adults. And uh, traditionally, the thought was that type 1 diabetes occurs in children, and you're
Mhm.
born with a pancreas that does not produce insulin. But more recently, we're identifying many adults who come up with type 1 diabetes at the age of 20 or older. And now, of course, we have some at the age of 40 or older. So you have to differentiate between type 2 diabetes, which is insulin resistance, and type 1 diabetes, in which the pancreas no longer produces insulin. And the answer to your question, why, I don't know the answer to that question. I just know that they do present at older than 20 and sometimes older than 40. John Buchanan?
Well, I think Patty probably asked what I was going to ask. Why would it be so late in life that you find out that you're type 1 diabetic.
Right.
Don't know the answer to that. Why? Uh, we just know that that is the case. As a matter of fact,
When you have symptoms, if your pancreas was not
yes,
secreting
whenever your pancreas is not putting on insulin, then you have poor glucose control, hyperglycemia, and then you have the same symptoms that diabetics have, polyuria, polydipsia, and then, yeah, and so uh, the, uh, it just happens at a later age. That's so interesting. Mr. Tatum?
I don't know what's wrong with my computer. I'll try.
Mute your computer for now. My daughter became type 1 diabetes when she was around 21, 22 years old. But before that, she didn't have any symptoms of diabetes at all. And I believe she had other comorbidities during that time. She was in the service. She was in the Marines. And it all happened around the same time where she had a rough pregnancy and she came down with type 1 diabetes. And to this day, she's taking Ozempic, and it helped her quite a bit. She wasn't overweight or anything during the time she came down with type 1. She always had a good weight, but it was just one of those things that just happened all of a sudden. Bam, type 1.
Yeah. Thank you for sharing. Okay. Any other comments or questions? Okay. We'll go to the next one, article. This is a interesting study that shows that amiloride, which is a diuretic, in the Korean trial, was shown to be more effective than aldactone, spironolactone, in lowering the blood pressure in patients with resistant hypertension. Actually, most of the hypertensive patients are treated with diuretics, so this is actually it's unusual in the United States for hypertensive not to be treated with diuretics. But in this situation, in Korea, that was not the case. And so it's a relatively new drug that is relatively inexpensive and can be used. Aldactone has its own side effects. And and that's the situation where someone is treated with hypertension and does not use diuretics. This diuretic can be used to uh, help resistant hypertension. This is something that has not been studied in the United States, but anyway, uh, things that happen outside of the United States eventually sometimes wind up in the United States. So it's something to be aware of. Although, as I mentioned, most patients who are treated with high blood pressure are treated with diuretics as well, particularly people of color.
And Dr. Callender, this drug is generic at this point, right? Too?
Yes,
Yeah,
but
that makes it even
I don't know
more.
that I don't know that it's available in the United States.
Okay.
Okay, although it seems like the biggest problem with hypertension is that the patients who have hypertension don't monitor their blood pressures and they don't take their medication when they're supposed to. Uh, Many of the hypertensive patients don't have blood pressure apparatuses to measure their pressures at home, and that I think is one of the requirements in order for you to be a hypertensive is to have a blood pressure apparatus so you can make sure that your blood pressure stays under control. Buchanan?
Yes, aren't there certain drawbacks to diuretics?
Well, there's side effects to everything. So yeah, diuretics, you lose potassium, and so if you don't take potassium, you can become hypokalemic. So yes, there are side effects, but there are side effects to every drug, whether they're diuretics or not. Yes. So they usually, if you take diuretics, your doctor will usually put you on potassium so you don't become hypokalemic. Okay, then we'll come to go to this is another large United States study when they studied 270,000 individuals, and those who had elevated uh, LPA were associated with the increased risk of atherosclerotic cardiovascular disease uh, and myocardial infarction and stroke, suggesting that taking medications to lower the LPA level would decrease this. And they don't identify in this article examples of drugs that are effective at lowering LPA levels, but they do indicate that in the patients who they did give the medication, that the incidence of cardiovascular uh, accidents or diseases decreased. And so then, since it affects higher in women and in Black patients, it's important to get this level. So the question is your doctor checking your cholesterol levels? And so do you know your cholesterol level? And that's important, whether it's the LDL or the HDL or the LPA. And so if your doctor's not getting an LPA, then you should consider it.
That was one of my questions, Dr. Callender. Is that a normal on when lipid level, when routine chemistries are checked, is LPA on there routinely, or do you have to is it a special request?
I think you would have to ask for it because most people
Yeah,
do the HDL and
right.
LDL.
I never heard of an LPA, but if that is associated with increased risk, you think that would become a little more popular, start including when people do go in for, even if somebody's had a history of high cholesterol, maybe that should be checked too.
No question. I think your point is well taken. That's something, just as we talk about screening for urine protein uh, as the first manifestation of kidney disease. Similarly, the LPA should be looked at since it's associated with so much cardiovascular diseases, with hypertension, with stroke and heart attacks. So yes, this is informing us that this is something that we should be aware of as we age, and to be sure that your doctor is getting an LPA.
I'm due for an appointment with my cardiologist and I'm on a drug for cholesterol, so I think I might see what my LPA level is.
I think it's a good idea for all of us. Right. Okay, let's go to the next article, please. Now, this is something that has become more and more discussed, frontotemporal dementia, which was popularized by the fact that Bruce Willis had this. I have a good friend who was a singer who developed this disease as well. And all of a sudden, she uh, started having signs and symptoms of dementia. And it was confused with depression and other diseases, but it was finally identified as frontotemporal dementia. And with Bruce Willis, who was a great actor, suddenly couldn't remember his lines and then lost the ability to speak completely. And so this is another type of dementia. Alzheimer's, the commonest dementia, but there are many types of dementias, and frontotemporal dementia where is something that occurs earlier, sometimes in the 50s and 60s. And so um, in many cases, it was thought to be Alzheimer's, but it wasn't. It's frontotemporal dementia, which is different than Alzheimer's. Uh, and uh, and right now there is no cure for it, uh, just as there is no cure for Alzheimer's yet. But it's a disease entity that we need to be aware of. That suddenly people are unable to speak or uh, out of a clear blue sky, and I think Willis, Bruce Willis, I think he was in his early 60s, late 50s, early 60s when it happened to him all of a sudden. Any of you have any experience with the so-called early dementias that people lose the ability to speak?
I had a very good girlfriend. In fact, she was a significant advocate for pregnant women and HIV and the use of AZT in them. And it's a tragic story because the dementia developed, and because she was always so bright and on it wasn't recognized for a long time. Um, it you know, bad relationship with her husband. Then they divorced. She wasn't paying her bills, um, and and I guess she was compensating because we don't talk about what happens, or I don't hear a lot about what's happening to the person who's now losing their ability to do things that they used to be able to do. It's so frightening. But she died in her 50s, and it was in her late 40s, around 45, that it developed. And it wasn't until she had to be hospitalized that we realized that it, in fact, was dementia.
Yeah, it's just as you mentioned. Sometimes I spoke to one of the doctor friends of mine whose wife developed this kind of dementia, and the only way he knew about it was the bills were no longer being paid, and things start happening like that. And that may be one of the earliest signs, but it's uh, it's something that really is tragic, and you see people who seem to be younger than the expected age suddenly no longer are able to carry on like they used to. Any other comments about this frontotemporal dementia? Okay, we'll go to the next article then. This is, we've been talking about CRISPR-Cas9 for some time, as the gene editing that is helping treat sickle cell disease and thalassemia and other things, has helped a child survive a dangerous genetic disease. And it was interesting because they compared the treatment for this genetic disease as being untreatable except by a liver transplant. Uh, and then they talked about this using this customized genetic editing, uh, which they won the Nobel Prize for in 2020. Um, and one of the things they mentioned was the cost of it. And I thought of John Buchanan, who always asked that question. And they said it was closer to $800,000, which is what it costs for a liver transplant. So uh, all of these things are associated with costs. And when they're doing the research on that, it doesn't come up. But as soon as after the research is done, and the cost of it is. And so this is the first time that the therapy was approved, but the cost, $800,000, is kind of prohibitive.
How
This
can
is
you
also
put a
as I
price
mentioned,
on life?
we do that all the time, every day. Yeah, we do it every day. And people who don't have the money die all the time because they don't have the money. And it's one of the realities of our lives, is that yes, uh, we say that we want treatment for everybody, but we don't actually do that. Uh, and For example, I don't know how many people have actually had CRISPR-Cas9 for sickle cell disease, which you can cure, and how much it costs. See, when they do the early research, it's experimental, and so there's no cost price for it. But once it's no longer uh, experimental, then there's a price. Dr. Perez.
I was going to say that so much of what the development, especially prior to this administration, the development of these therapies and treatment is on taxpayer dollars. But then once it's established, it often isn't. So that's an ethical discussion that's important that we push, especially now.
Yeah, yeah, very good point. Uh, and that's why it's so important to have the community involved in all of these new therapies, so that this can be uh, included. That John Buchanan.
Yes, Dr. Callender, they quoted 800,000 for liver transplant, but did they mention how much the CRISPR costs?
That's what they said. Yes, they said that it's about the same cost.
Oh, about the same. Okay.
Yeah, that's why they use it. They said it's about the same uh, cost as the CRISPR for this particular child.
And that would be without the immunosuppressive drugs needed for a lifetime, right?
Well, the CRISPR would have. You're talking. Well, of course, the medication is
Yeah,
that's including everything.
yeah.
The
But the
the
CRISPR
800,000.
doesn't, when you get the gene editing, you don't need immunosuppressive
No,
drugs.
you don't need anything, right?
So
Right.
that is probably a healthier lifestyle than someone who's taking immunosuppressive drugs.
Yeah, of course, the disease she has, that child had, is lethal. So,
Hmm.
but, but you know, the ethical issue remains large, and um, how do you deal with those kinds of situations where your child could be saved if they had a therapy that costs about $1 million, and you don't have that kind of money? How does one handle that ethical issue? It's something we tend to push under the rug, but it's something that is going to become more and more discussed. Dr. Perez?
As your good friend, Dr. Freeman, said that if we had the same discussion or a similar discussion as it related to cancer. And the bar had to be moved because the public, just as we are getting involved, now had to get involved. If we didn't move forward in Giants, I mean in transplantation with you involved the community. You made it known that there were other answers. Yeah, I remember being a part of this group where there was somebody who wasn't even offered a kidney transplant coming from
Yeah.
Georgetown because they wanted to wait until certain people got so sick. So the fact that it is available, and I don't think it's even a question for humanity that's national. When these therapies, when these brilliant discoveries are made, it should be available for everybody.
Well, it should be, but is it possible for it to be available when the prices are so costly? If you have something that's going to cost $1 million, how does one fundraise to get $1 million? And so this is the ethical dilemma that I think is addressed by having people from the community be on part of all of these boards, so that uh, the little man can be a woman can be uh, recognized as somebody who is as important as anybody else. And this is an aspect of healthcare delivery that we have not yet addressed satisfactorily. Uh, for example, this particular child, if there's another child like this, and there are, who's going to be willing to pay the $800,000 for that? And of course, that's an issue that you brought up that is a critical issue. Uh, because as we come up with these innovative and creative things, uh, the first developments of these things are extremely expensive. It's only after it's used and used and used that the cost comes down and it becomes at a point where a normal person can afford it. And so what happens to all of the children who need CRISPR therapy? Uh, for example, do we know how many of the patients who have sickle cell disease actually can take advantage of this CRISPR therapy? Anyway, that's an issue that affects us, and I don't know the answer to that question, but it's a very important ethical aspect. Any other comments about this issue of addressing new and innovative, expensive therapies? Okay, well, let's go to the next article as we think about it. Now, this is an article that talks about a product that is often called gas station heroin, which I never heard of before, because it's available at gas station stores. And they noticed this product, tianeptine, is associated with many adverse events, especially death. And apparently, it is given orally, and people are dying because of it. Uh, I'm sure very few of us have ever heard of the so-called gas station heroin. And why it's available at gas stations, I'm not sure of either. But it becomes an issue because people are dying because they're taking it. And so the FDA is therefore issuing a warning about it. John Buchanan?
Yeah, this is uh, very popular at gas stations. Back in the day, I guess maybe as many as 10 years ago, K2 uh, was sold at gas stations, and government tried to put a stop to it, and the makers would just change one sidebar of the chemical and uh, resell it under another name, and it would still have that effect. Very to me, it's bizarre that gas stations would be selling it. First of all, I mean, Shell, Exxon, Sunoco, these stations that you sell cigarettes and things. So they figured, but the K2 was smokable. I think they're talking about this is you just eat it.
Yeah.
Very, very bizarre that this would be allowed. But again, the government, when they find out about it, the manufacturers just change one side bar of the chemical and resell it, repackage it, resell it.
Kind of scary
Yeah.
that they could do that. Yeah, it's frightening. Because our children and grandchildren could be killed by this. Yeah. So, okay. Darryl Armistead.
Yeah, this drug is sold over the counter at gas stations as a dietary supplement, and so it's not regulated by the FDA because they don't regulate dietary supplements. And currently, only a few states have imposed regulations and bans on the sale of tianeptine.
Scary, scary, scary. Okay. Well, we just need to warn our children and grandchildren about it. So, hmm. Okay, let's go to the next article, please. Now, this is good news in the sense this is U.S. overdose deaths fell 27% last year, the largest one-year deficit decline ever seen. Uh, it's hard to believe that 80,000 people died of overdoses last year, and that's 27% lower than 110,000 2023. Wow, that's amazing. And of course, they feel it's due to the availability of naloxone and expanded addiction treatment and shifts in how people use drugs. Uh, it's alarming to me that 80,000 people die every year because of drug overdose. And alarming that that's a tremendous drop down from what it was before. And so the question is, will we continue to see this drop? Will the new administration continue the policies that have resulted in this? Uh, and I guess time will tell. One of the things that we don't really address is how many people are actually under drug addiction programs and require these drugs that they take in order to be normal and to work and do other things. And will the new administration continue these programs, which are saving lives? And I guess time will tell on this, but at least this is good news that we should celebrate. but with the intent to make sure that our new administration continues that which has resulted in this drop in death rates from drug overdose. So, any ideas as to what you think the new administration will do? Dr. Perez.
Well, they probably disinformation is a major thing. And with opioids, we found a different level of understanding of addictive disease, so that we had a community that was more embracive of it and saw addictive disease in a different way as us as opposed to a them. And I think that's a crucial component. It was available to families to open up their eyes, discussions on a whole addictive disease on a totally different level than when, as we discussed in the old article, the previous article about heroin, and who were people who were addicted to heroin. So we, what they call it, the tipping scale, we have gone there, but we can easily fall back if we don't continue to have advocates for this. What has happened to SAMHSA, Substance Abuse and Mental Health agency, and the federal government has been slashed. People who worked, whose passion for this, have left the government. It was a place where you could do work, do your research, be passionate, and do good work, and have a bit of security in place of a higher income. But now even that type of security has been gone. I doubt in my lifetime that it will return. It's horrible. It's really, really horrible. And so it is important for us to maintain the conversation so that we don't go back to the them and the us, because that would be horrible. When I worked in New York City, there were 900 beds. 900 beds for adolescents. I mean, I don't know anybody who's addicted, who has addictive disease, who wants to be that way. But where's the treatment? We know mental health, the issues of isolation associated with post-pandemic are skyrocketing.
Well, what is frightful is that the sensitivity is gone. And what is going to be the consequence?
Dr. Callender, the article points out that, now there's concern that there's not a lot of testing for fentanyl, and fentanyl is kind of replacing the opioids, if you will, in a way of overdose deaths. And I don't know if there's going to be money in our government for screening for fentanyl, if that's going to take care of it, or if it could become the next crisis.
It is, not will become.
Yeah.
Darryl?
It's kind of like whack-a-mole. Actually, with all the conversation about fentanyl, that the level of fentanyl is decreasing. What's being smuggled into the country.
Yep.
So that is having an effect. And on the other hand, as fentanyl use goes down, crystal meth use is going up. And that's not a matter of being smuggled because historically crystal meth is manufactured right here in the United States. So I know we're not talking about crystal meth, but both fentanyl, both opioids and crystal meth are killers.
And I don't think our
Thank you.
current administration is going to be sensitive to issues that, are affecting lower socioeconomic people, really.
Okay, thank you, Darryl, for sharing. John Buchanan.
Yes, is the naloxone, is that a treatment for fentanyl overdose as well?
I don't know the answer to that question.
I don't either.
I don't either. I don't think so.
Yeah,
What was the question?
his question was what was your question again, John Buchanan?
Is naloxone a
Oh,
treatment for fentanyl overdose?
yes, yes, it is. Oh, I didn't understand what drug you were talking about. Okay, yes, it is. Yes. The issue that really rises to the top of the discussion is, will the new administration be sensitive to the growing number of drug addicts that are present in the United States, and to the fact that that they are supporting uh, this program rather than eliminating it because it doesn't uh, create more funds for the rich people. So that's the question. Right now, it's working, and so will the new administration be sensitive enough to understand that a step in the wrong direction could create a new epidemic of drug addiction, unlike anything we've ever seen? Because we, in many ways, what we've done is supported the drug addiction process so that it is controlled. So if we were not to look at it from that perspective, then we might go backwards, and that would be uh, tragic. And I think that that's the issue that Patty Delone and Dr. Perez were addressing, and and it's all about sensitivity that may or not be present in the new administration. I don't know. We'll have to wait and see. I know Dr. Perez is taking the position that it's not there. Uh, uh, but I don't know that it has even been addressed because you have to be aware of it to understand it in order to treat it.
Dr. Callender, this decrease in overdoses happened as a result of the Biden administration policies.
Right. That's correct.
So, going forward, we will have to wait and see, right? What's going to happen?
Right.
We
And
have to elect people who will make sure that this atrocity that's going on does not continue.
the impression is that that's what he's going to do is wipe out all of the Obama and Biden policies. That's his goal. So, will that really be the case? Will he change it for this particular instance or not? I don't know. I'm not going to predict, although others may have already predicted because they two and two make four. Yeah. So, but You've seen some of the comments by some of the uh, Congress people that they see that it's working. So why would you do something to undo what is working?
Then there are those that think with the overdose deaths decreasing means we're doing something wrong.
Why would one think that?
Because it's part of the um, effort to get rid of people.
Okay, all right. I hear you. I hope that that's not the case, but yeah. But hey, it's a new administration, so we shall see. Okay, I guess we've had
And
enough
I
conversation.
guess there's one other thing. Many of the studies, many of the trackings that we have been doing by grant work, block grant work that goes to states, many of those studies have been stopped. I mean, when I was trying to do something for a presentation, many of the websites and stuff from CDC, from SAMHSA, those the graphs, all of that. Those websites have been shut down. So I mean, what? What?
Well, it's just, yeah, your points are well taken. That the evidence suggests that they're going to move in another direction, but it's up to the Congress of the United States to do something about it. Will they? I don't know, unless we uh, force them to, perhaps. Okay,
Only
let's move.
only if it was affecting the millionaires, Dr. Callender.
Wow, that's a sad commentary, but it may well be. I hope you're wrong. Hope you're wrong. Hope you're wrong. All the evidence points to the fact that you are right, but uh, I think you're wrong. Now, this is an article that is about asthma and the fact that it can be reversed. That's an interesting debate because uh, any of those of you who have asthma sufferers in your family, you know that it's a disease that is there for the life of the patient. And there are remissions and exacerbations throughout the course of life. And sometimes it will go away. I know my children, when they were 5 and 6, had asthmatic efforts, but exacerbations. But as they grew older, they never got it back again. But then you have other people in my family who have asthma when they're little and they still have asthma and they're 80 years old. So, uh, in some instances, the asthma can go away completely, and in many other instances, it doesn't go away. And so that's why there's a big debate about whether you have an actual clinical remission of asthma. Dr. Perez, you were a pediatrician. What are your thoughts about the debate about the uh, asthma and it's going away and coming back again and not and actually having a complete remission?
We didn't look at it that way, but now we're seeing that opportunity. And when you talk about the costs of and being able to follow and make sure that all of the therapies that we now have available are available. We did nothing with the eosinophils. It was that you had asthma. We tried to keep you in remission as long as possible, but the thought that it could be completely go away was not the training that I had. But now we can do that. Um, but do we have the will to do that for everybody? And that becomes very important. Same discussion that we've had. It's up to us.
Thank you for sharing that perspective. And they have so many new drugs and trials that they're doing. So there are those who really believe these biological therapies will make a difference and treat people who had asthma may have actual remissions of the asthma.
And there is nothing like seeing somebody fight for air.
Wow.
Nothing like it.
Yeah. It's really, I had one sister die from asthma. So I know what you're talking about. Any other comments about this article? We'll go on to the next one. This is an article that talks about cataract surgery and that patients who have poor vision are not afraid of having cataract surgery, whereas patients who have good vision fear cataract surgery. Cataract surgery is surgery that is done under local and does have complications like anything else, but it is a local treatment and it's successful most of the time. But like everything else, there are complications, and I think that those people who have poor vision because of the cataracts recognize what they've lost, and so they recognize the value of getting a cataract surgery. Whereas those people who can see well, they fear that they will lose their vision. So that's based upon this study is what is going on. Most of us who are at the age of 60 and above uh, have the likelihood of developing cataracts and the likelihood of requiring cataract surgery. And this is why you go to see your ophthalmologist at least once a year. And when the cataract, the opacity becomes affects your vision, then the ophthalmologist would recommend surgery. As long as you have the opacity and it doesn't affect your vision, they tend not to recommend surgery. Any comments about cataract surgery?
Well, I would just like to say I had cataract surgery. And not only did I have cataract surgery, but then the lenses that I was wearing for contacts were implanted permanently when the cataracts removed. So I can remember the first day it came out after cataract surgery, and everything in the world seemed 10 times brighter. I've not had any complications, and I would recommend it to anybody. It was a little scary, and you do it when you're wide awake, and it's frightening, but the benefits have been amazing, and it was probably 10 years ago now.
Patty, did you have any pain?
No,
Wow.
none at all.
Betty Baylock?
Yes. My ophthalmologist tells me that I have cataracts, but every time I go visit, he says it's not bad enough right now for me to have surgery, not unless I really just want it. But my vision is fine as far as I've always worn glasses since high school, but I'm nearsighted, so I'm usually around my house most of the day without my glasses. And I wear glasses maybe at night when I'm driving or whatever, but I see very well, but just like Patricia said, several other people mentioned how bright their vision was when we were talking about this before, after after their surgery. But I don't know that my vision is that bright, but I can certainly see. And so I even asked my doctor how, because I'll be 81 in a couple of months, and I asked him if, age had anything to do with the surgery. And he told me he had operated on a 90-some-year-old patient. So I felt
Right.
good about just waiting.
Okay. Any other comments? If not, this will be our last article. It's 10:30.
One
So,
comment I'd like to make, I've had cataract surgery, and the improvement in my case was not so much everything was brighter, but the colors were more defined. I mean, orange was very orange and red was very red. But my whole purpose was driving at night.
Yeah.
The headlights on the other side of the road beaming toward me causes all kinds of diffraction in my eyes and scattering the light all over the place. And I would just have to either turn my head or just drive during the day. So it was much improvement after surgery for driving at night, and headlights on the other side of the road affected me not so much now.
okay. Well, thank you everyone for attending. We've had once again a great response by you, and the feedback, as always, is wonderful. Thank you for being here, and look forward to seeing you again next week.
Thank you.
By the way, John Buchanan won't be here next week, so
Week after next, John.
we got to know.
Yeah.